I did my senior project on C. elegans and their preference towards cannabidiol, which is CBD, and the abbreviation in the title was, I'm going to say, is C. elegans then. So for the contents of this presentation, I'll be going over the medical use, the cannabis breakdown, potential side effects, pharmacology, prior research, why I chose C. elegans as my subjects, the research that had been conducted by myself with my mentor, Dr. Clerical, and research continued, and the references. So with the medical use, CBD can be medically prescribed to help treat epilepsy that has not been responding well to other forms of treatment and other medications. So they have came up with an actual medical grade CBD, and it has been shown to help with seizures. And its overall pain relieving aspect of it also makes it a very sought out drug to be used. So the overall cannabis breakdown, as you can see, most people think when they hear cannabis, they think of marijuana innately, and there's actually two forms of cannabis, as you can see in this diagram here. There is one that produces THC and one that does not, or as the public thinks. So if you look at this little diagram here, we have a very, very small number of THC. So the government actually claims that as not having THC, which isn't fully true, as we can see, and we know as people who use research and know claiming false things like this isn't all it should be. So we have the hemp plant, which has the CBD oil, which we can actually buy over the counter, which you can have sold to you from your pharmacist, as it can go to, you can pick it up at a gas station even. And then the ones that produce more THC are the ones from the marijuana plant, because they also produce CBD. But this one is the one that's illegal and we shouldn't be using, versus, obviously, like I said, the hemp-derived one. So the potential benefits of CBD may include, but are not limited to, things as, like I said previously, pain relief. It can help with anti-seizure effects and a plethora of other things, but the possible side effects depends on the person. It can produce skin irritants, as it says, risk of fungal infections, but it is also used as, it's an antibacterial, which is kind of interesting that we see this adverse effect in some people. It can be used to help with anxiety, or it can create anxiety. It just depends on the person, and that is why it's so difficult with it being over the counter, because you don't know how much CBD is in it, as well as how it's going to interact with you. So the CBD that is prescribed to you is going to be known as Epidiolex, and it's actually in 100 milligrams, and it's an oral solution. And I included some little facts about it just so you can kind of get an idea. It is clear, but it can also be seen to be colorless to yellowish type of liquid, and it has a sweet taste to it, an effort to, be able to take it orally. The prior research that has been done, so one of the studies that I chose to include is a study done by Falla and Berman in 2019, and they used the effects of CBD in terms of their subjects were Sprague Dawley rats, which we also used in Dr. Slazak's class. So we have a pretty good understanding of the subjects being used. And with these rats, they were implanted with bipolar electrodes in their right amygdala. And the three different conditions, or the three different groups, I should say, were the ones treated with the dosage of CBD, which ranged, as I have listed here, THC, and then another group with a combination of THC and CBD to see the overall effects and if one performs better than another. So what they found was that the CBD group inhibited the seizures, the generalized seizures, as well as focal seizures when given the proper dosage. And then with the THC group, they also had the same effect of assisting in the decrease in seizures, but as we can see here, it had to be used in quantities that would create psychoactive effects, which we are trying to get away from, and that's why CBD itself is more marketable, because you're not going to experience that high, and is furthermore the reason for my research was that if it's being sold to treat certain things like anxiety and such, it should have addictive qualities or properties. So that was the thought process behind everything. But as we can see, and as I spoke about originally, the 0.3% THC that is found with CBD is so low that you don't experience that high, which makes it more sought after. But then the group that had THC and CBD combined, they also saw improvements. So regardless, we are finding that cannabis actually does assist in the overall, you can use the umbrella term, the overall decrease in seizures. And that is a big win for science, and proves to have a lot more to be researched. So the reason why I use C. elegans were because they are small in size, short reproductive styles, which means that the ability to see in my research on a lifelong subject was a lot more accessible than other participants who only had a short time period. I was able to see how it affected them in their teenage years, in their adult life, in their adolescent life. So it was very interesting. And there's also lowered ethical concerns since they are nematodes. They're worms, and their life cycle, like I said, is so short that it's almost irrelevant. But the research that I had conducted, which, like I said, was the C. elegans preference towards CBD because of that addictive possible addiction aspect, was that overall the subjects that I used, the C. elegans, aged to young adults in two conditions, and we had two different groups. So there was a group of naive worms and then a group of worms that had been pre-exposed to CBD. And I wanted to see if that was another factor when comparing to women who are carrying a child and they are using CBD, to see if there is a predetermined factor then, or a genetic factor towards it. So the procedure overall was I did a chemotaxis index, and I had a CBD assay, and in these Petri dishes, there was a line drawn up the middle, and the C. elegans were placed in the middle, and on the left side we had the control, which is going to be the coconut oil, which is the primary ingredient, one of the ingredients in the CBD itself, in the little tincture. So we used that as the control, and then on the other side was the CBD. So we were able to better distinguish if there was a sort of preference towards one side or the other. And we were counting how many C. elegans were on which side in 3 sets and 3 trials. So within 90 minutes, we were able to see if time was a factor, if group was a factor, all of the above. So that was the overall procedure. And then what we found was that the C. elegans that were not pre-treated prior ended up preferring the drug solution compared to those that were pre-treated. And this goes to show, as I stated earlier, my original hypothesis that C. elegans in both CBD pretreated and naive groups would prefer CBD over the control was actually not supported, as well as my hypothesis that the longer the duration of exposure, the more attracted to the C. elegans was also not supported. But there was a trend that we were able to see. It wasn't significant, but it aired towards a possible trend that could be further researched between the viewing, the interaction between the time and the group. So that allows for more research in the future. And then these are my references. And I just wanted to say thank you to Dr. Clerical for helping me and being basically my saving grace in terms of my senior year. So thank you for your time.